Good afternoon, and thank you for joining us for today's virtual media briefing about COVID-19 with London City Mayor Ed Holder and the Medical Officer of Health and CEO of the Middlesex-London Health Unit, Dr. Chris Mackie. Just a reminder for the media who are with us today to please submit your questions indicating your media outlet and your name, and a welcome also to those joining us on Rogers Television, on the Rogers Facebook page, or on the Rogers YouTube channel, as well as those listening on Global News Radio, AM 980 CFPL, and those joining us on the CTV London website. We will turn things over right away to London City Mayor Ed Holder.
Thanks, Dan, and Dr. Mackie, and if I might say to all media here, I was just on an economic task force session. We do 4 every week from different parts of our economy, and from the financial institutions, there was a shout out to Dr. Mackie and the health unit. They were very clear that they wanted to ensure that I expressed on behalf of the business community the kind of leadership that's been shown by the health unit, and specifically Dr. Mackie, you and your team. And I want to share that because I think it's important that people appreciate the kind of work that's being done at the health unit level led by you. So I'm very impressed with that, and I promised them I would send that message forward. In addition to that, as we enter into Ramadan, I'd like to wish our Muslim brothers and sisters in London, in the region and around the world, a joyful and blessed Ramadan. Beyond discipline, Ramadan instills a sense of empathy, something that I would say now more than ever so required. And as was the case with Christians and Jews during Easter and Passover, this year's Ramadan will be different. Physical distancing remains paramount, and with the large discussion we had with the faith-based community yesterday, the recommitment that they will continue safe distancing, that they will continue with remote celebrations to protect their own and certainly to protect Londoners. In that vein, I also had the privilege today to address about 1,000 London Health Sciences, physicians, nurses, healthcare staff, and medical staff, administrative teams, and support workers. And, I thank them on behalf of all Londoners for the work that they're doing and for the sacrifices that they make on our behalf. And I also made a point of thanking their families, because those are the unsung heroes that who we don't see, that have to put up with and deal with issues of doing things they might not otherwise do if their family was all together at various times, and the risks associated with that. So that message of thanks and gratitude from Council, from all Londoners, was sincere and heartfelt. Finally, the thing that we touched on yesterday was the significant financial impact of COVID-19 and the impact on the city budget, and I would like to just give you a quick update. So what we know is that we have about $23 million of unbudgeted COVID-related expenses, which will increase by an additional $10 million by the end of summer. You should be aware that the Federation of Canadian Municipalities is urging the federal government to provide at least $10 billion in emergency operating funding. I've been part of that discussion. Councillor Morgan, as the FCM rep, has been very integral to this discussion as well. Because here's what's clear, is that it's about keeping essential municipal services going strongly for all Canadians in every part of the country, and Canadians do depend on the essential municipal services that we all have come to appreciate and depend on. And in addition, our most vulnerable need us to keep going because they are so seriously at risk. And it's a crisis of non-recoverable financial losses. And it's exceptional. I mean, we have a situation where the London Transit Commission, by the end of the summer, will be at a point where we project that they will lose $12 million by the end of summer just from lost transit ridership alone. And, when you look at lost revenues from parks and the like, it's significant, the millions of dollars that we will not be able to take in as revenues, and has impacts. The promise we made yesterday, there would be no increase in taxes that have already been approved, and there will be no cut back in essential services. That's our commitment to Londoners. But it's why no municipality can do it alone, and why we truly depend on the support of the senior levels of government, and why the $10 billion funding request on behalf of our Federation of Canadian Municipalities to the federal government is so critical. So with that, I want to say thank you so much for that. But Dr. Mackie, may I turn it over to you, please?
Sorry, Dr. Mackie, your microphone is muted.
Thanks, Dan. Thank you, Mr. Mayor, and for your leadership on this important file. Your voice is much appreciated, and you're using the influence you have in our community for good, and that is deeply appreciated. Let's start with the numbers. Provincially, we are still seeing high levels of numbers of new cases diagnosed each day. We had 634 cases diagnosed in the past 24 hours. Locally, we actually had our best case count in weeks at this point. Only 4 new cases diagnosed locally. So the steps that people are taking to ensure physical distancing are making a huge difference. Unfortunately, we continue to see deaths provincially and locally, and we had 3 additional deaths in the last 24 hours in the Middlesex-London region. This includes 2 deaths in long-term care and 1 death in a retirement home. Again, the vulnerable populations, we knew that this impact would be hitting the most in the coming few weeks. I mentioned yesterday there's an enormous effort underway to test every single person residing or working in a long-term care facility, given that we know these are the highest risk settings at the moment. That work is continuing apace. By the end of day tomorrow, all of the high-risk facilities, including all facilities in outbreak status right now, will be tested fully. All staff and or patients in the long-term care homes, whether they have symptoms or not. Other good news on the retirement home and long-term care home front, we were able to declare 2 more outbreaks over in the last 24 hours. That's in addition to an outbreak that was declared over earlier this week. So the count of outbreaks is reducing significantly, and we're down to 6 at the moment. We also had a question about the risk assessments that came in from Jen Byman at the London Free Press. Jen was interested in how the risk assessments had been going, and the answer there is that things are going quite well. We have focused those risk assessments on places where we knew there were high level of activity, but about of the roughly 50 homes in our area, we've been able to complete risk assessments on 33 of those homes, and all of the homes that we had a reason to suspect were in the high risk category have been examined closely. So very grateful to our partners in the long-term care homes who are working with us on those risk assessments, and also to the medical students from Western Schulich School of Medicine and Dentistry who have been leading the charge on getting those risk assessments done. That's it for me today, Dan. Happy to take any questions.
All right. Thank you very much, Dr. Mackie and Mayor Holder. Well, we've got 5 questions lined up, so we'll get to those right away. And the first one, Mr. Mayor, is for you, and it's from Steve Young at CTV News London. Mayor Holder, we are seeing businesses, small, medium, and large, start to really struggle through COVID-19. What can the city do financially to help them? Follow-up question, are you asking for tolerance from property owners to give business a break on their rent until we can get on the other side of this?
Well, coming from a small business family focus, Steve, I empathize, and my family is certainly living some of the challenges that companies are out there in our community. So from our standpoint, there are some things that we as a municipality can do, and we will do all that we can as a municipality, specifically 60-day deferrals on property and business taxes. We think that was a thoughtful and appropriate thing to do. If there are some municipal programs where people have taken loans, we've got deferrals on that as well. Want to recognize that a deferral is not a non-payment at some point, and there may well be some smoothing things we can consider. But one of the considerations that a municipality is limited to is the issues around insolvency. We cannot go beyond our means. We can't spend more than we take in. That's by legislation. It's why it becomes so critical, and your question today is so appropriate because of the major ask we have to the federal government on behalf of big city mayors, but really on behalf of all mayors through the Federation of Canadian Municipalities, to help us because, again, no municipality can do this alone. What we're able to do in the short term with that promise of maintaining essential services and no increase beyond approved taxes. You know why we can do that? We can do that because this city has been well managed from an administrative standpoint. A AAA credit rating for 43 years has allowed us to be able to, when necessary, dip into certain reserves that have been built up over time. But even that has its limits. So as a result, we are doing what needs to be done for business as best we can. And now the next piece of that is we need to rely on our federal governments more than ever.
Okay. Thank you very much, Mr. Mayor, for that response. Dr. Mackie, the next question is for you. And this comes from Andrew Lupton at CBC News London. Dr. Mackie, could you clarify the difference between long-term care homes and retirement homes as they pertain to the statistics you've shared?
Yes, for sure. So long-term care homes and retirement homes are both kind of on a spectrum of supported living. The main difference is that long-term care homes are specifically defined under legislation. It really comes down to the source of funding and also the level of care provided in the facility. In general, retirement homes are privately paid and have a lower level of care. So these are for folks that generally are able to live more independently, may need a bit of help here and there, may need to have meals prepared, but in general, they are able to care for themselves. Whereas in long-term care homes, you may need a lot more support, and this home is part of the provincial healthcare system formally defined in legislation. So they're very much in a spectrum. The balance of risk is really dependent in those settings on the care needs relative to the availability of care staff, because in general, retirement homes have lower risk residents in those homes, but they also have a lower level of care. And so it's easier when you have higher ratios, for example, of residents to staff members. If one or two of those people become quite sick, it can be very difficult for the home to cope. Whereas in a long-term care home, there's a bit more expectation of that level of illness and a bit more ability to adjust when it does come.
All right. Thank you very much, Dr. Mackie. Dan Brown from the London Free Press has the next question, and it's actually for both of you. For the Mayor and Dr. Mackie, I know we still have weeks to go, but I'm wondering if you can talk about any lessons you've learned so far during the pandemic. Also, did you think Londoners could successfully beat back the coronavirus through measures such as physical and social distancing? I'll leave it up to, Mr. Mayor, why don't we start with you on that question, then we'll throw to Dr. Mackie.
Sure. I think in terms of lessons learned, the second part of that might, I'm not sure if Dr. Mackie would like to address it more fully than me. But in response, did I think we could beat back this pandemic? If that's the question, and Daniel, correct me, let me say this. We haven't beaten it back yet. What we have done, though, with the impacts of safe distancing and rules around crowd control, I want to come back to that as well. When we have no more than 5 people assembled, but when they're assembled, again, we're still talking about safe distancing. I think that I have tremendous confidence in Londoners' willingness and ability to respond and cooperate. Look, I mean, when we first started this process and we focused on education, the health unit, with great leadership, focused on education. You'll recall when we started to go into some enforcement, and that first weekend was a little ugly, especially if you were the one getting the ticket. We said back then, if we can't educate you, we'll educate your bank account. And we weren't trying to be flippant, but we were trying to make that point that there's at some point where you have to say you're putting lives at risk, and that's not right. The good news is that those bylaw charges are dramatically reduced, like dramatically, and so people are getting it. And I think when you hear the kinds of results that Dr. Mackie announced earlier, you pray to God that we are working through the worst of it as we work on the road to recovery. In terms of lessons learned, we're going to go through a new normal in terms of how we do a lot of the things that we do, in terms of technology, in terms of working in some cases more at home. What will the impacts be on business and office as they go through what they do? Good practices in terms of work conditions, I think, will come as a result of this as well. It's too early to say what the lessons learned will be, but I think we're learning them as we go. And I think it'll make us a stronger economy, and I hope in a number of respects a healthier society as well.
All right, thank you, Mr. Mayor. Dr. Mackie.
So in terms of lessons learned, I agree the most important lesson that we've learned here is that the Canadian people are willing and able to take up a collective challenge. I've been so impressed with the how quickly people have changed so many aspects of their lives in terms of where they shop, how they eat, how they interact. These changes are incredibly important. They are temporary. We will get through this, but it's just been amazing. The enforcement has been an important part of the picture, but the number of charges laid has been quite low, considering we're talking about directives that apply to every single person in our society. And I mean, speaking from the health unit's perspective, we have very strong legislative powers as medical officers of health to order businesses or individuals to take certain actions if they're not complying in a way that puts others at risk. We've had to issue exactly 0 orders. The bylaw and police have done important piece of enforcement, but whenever we've had individuals or businesses that weren't aligned with the directives, it's almost always been about education, and people have very quickly complied once they've had a conversation with a public health inspector or one of our other staff. So that's really the biggest lesson, is around the resilience of the Canadian people and willingness to take steps to protect the people around them. I think we've also learned about how much our community had to learn. Most of that learning is happening around what the role of public health is. Most of the time, public health flies under the radar. We have about 40 different programs that we offer that are all oriented in one way or another at preventing disease, keeping people out of the healthcare system, keeping people well, preventing the spread of infection, but also, supporting young families to make sure that children get the best possible start for life, that prevents all sorts of chronic diseases, mental health problems later in life. And it's actually really exciting in one respect to see people coming to grips with, understanding, and appreciating the work that public health does. A lesson, it's not a new lesson, but it's one that we keep seeing over and over again, is the importance of the media in getting out appropriate public health messaging. Our local media has been really as powerful a partner as anyone else in the fight against coronavirus.
And Dan, I just want to add one more thing. It just because I reflected on that as I heard Dr. Mackie speak. Lessons learned. I hope it's that we absolutely do not take our first responders, our frontline healthcare workers, our staffs at hospital. I hope we don't take them for granted. My sense is today, it's a lesson learned. It's certainly a short-term lesson learned, and I hope it's a long-term one because they are the day-to-day folks that matter most to all of us.
Thank you both very much for those answers. We're going to move along. Dan Brown from the Free Press has another question. This one is for Dr. Mackie. Dr. Mackie, can you give us an update on the field hospital at Western Fair? Has it come into play yet?
Sure. It'll be a pretty brief update. The field hospital at Western Fair has not come into play yet, and that's largely because the hospitals in this area have a lot of capacity right now. There are beds available for those that need it, whether it's someone sick coming from long-term care or directly from the community. There is not need at this point to go beyond the walls of the existing hospitals.
All right, thank you very much. Mayor Holder, the next question is for you. It's from Scott Navarro at Rogers Television. Mr. Mayor, are there any updates on festival season events or a timeline for those decisions?
We met with the festival's organizers early this week, and we're in the process of making some determinations in conjunction with them. Some have already determined, frankly, that it's not in their interest to carry forward, only because the lead time to organize acts which typically do tours, so they'll be in one city, then rotate to another and rotate to another. And every municipality is dealing with this in their own way. So that becomes part of the challenge. And as well, the lead time necessary to organize a significant event. So it's my thought that by Monday, I think some clarity around festivals and events will be in place, and we'll leave it then before we make that announcement.
Okay, very good.
I can make the announcement on this program. Stay tuned.
All right. Mr. Mayor, there was another question from Steve Young, and I think this was the follow-up from his first question. And he is asking if you are asking landlords to help businesses that are struggling. Are you asking them to give them a break on rent?
Yeah, sorry, Steve. Thank you. I meant to cover that, and I just missed it in the longer answer. The first part, the answer is that we are asking our owners of properties, to the extent that they're able to support by deferrals. It is not our place as a municipal government to tell any owner of a property what they can or cannot do with their tenants, but we can certainly encourage and ask them for their support because they're all going through it. So here you have a situation where businesses are struggling. Owners of properties get it because they want them as longer-term tenants. So the key that I've heard time and again from owners of properties to the business tenants, have that discussion. Sometimes it's not a comfortable discussion, but it's an important discussion.
All right, thank you very much, Mr. Mayor. We do have a couple of more questions, and I'm just looking here. We've got the question about, from Grant Demi at MyFM in Strathroy. Dr. Mackie, this one is for you. Do we have a number on COVID-19 tests administered so far in London and Middlesex County?
Yes, thanks for the question, Grant. We have, over the last week, developed a system where we can now track all of the tests that are being submitted. It's in the range of 350 tests per day, just from Middlesex and London. We don't have a total going back, but my best estimate is that we would have tested between 6,000 and 9,000 people in Middlesex and London since the beginning of this pandemic.
All right, thank you very much. We've got a couple more questions in the queue, which will probably take us right to 2:30. Dr. Mackie, this one is for you. It's from Sawyer Bogdan at Global News Radio, AM 980 CFPL. Dr. Mackie, how long will it take to get the test results for all long-term care homes and retirement homes? As we hit the peak and the focus shifts to the residents in these homes, do we know how many more cases we can expect in these places? Are new outbreaks still a possibility?
Okay, great set of questions. Thanks, Sawyer. So first of all, we are planning to get those tests swabbed, getting people swabbed, so the clinical part of taking the test sample within the next 2 weeks, ideally a bit sooner than that. We're working with the local lab. That's the sort of the timeline that they think they would be able to process those tests on. And provincial capacity for lab testing is strong at the moment. So we think that that will be roughly the time to get the swabs done. And then the turnaround time in the labs is 1 to 5 days, probably an average of 2 to 3 days. So it would be within a couple of days after that that we'd have all of those lab results back. In terms of outbreaks, the new provincial definition for an outbreak of coronavirus, usually we look for 2 cases of an illness in a hospital ward or in a unit of a long-term care facility in order to define an outbreak. The province has changed that outbreak definition to just 1 case. So there's no doubt that as we do identify cases in long-term care homes where there haven't been cases before, we will see new outbreaks declared. Hopefully those outbreaks can go as well as the 3 that we've declared over this week, and there's not much spread of the illness in those settings.
Thank you very much, Dr. Mackie. We do have a follow-up question from Sawyer, and this one is also for you. Yesterday, an outbreak was declared in the cancer treatment unit at Victoria Hospital. Are you able to give us an update on that situation?
We don't have an update for that situation. What I can tell you is that obviously this is a high-risk setting. We're working hand in hand with the hospital to make sure that there is as much protection of the vulnerable patients there as possible. Staff on that ward have been using personal protective equipment carefully with all of their patients for some time now. And the hospital is doing everything possible to make sure that outbreak does not spread.
All right. Thank you very much, Dr. Mackie. Well, the time has flown by. It's that half hour is already done. Dr. Mackie, Mayor Holder, thank you again very much for your time and for sharing your thoughts and your answers to today's questions. We will be back tomorrow afternoon at 2 o'clock. We look forward to talking with you then and answering your questions. Until then, thank you once again. Have a great rest of your day.
Thanks, Ed.